The greatest thing that's happened in this industry in the past couple of years is the advances that have been made in fat reduction and body sculpting. Let's face it, we've all been a little appalled at the sight of old-fashioned lipo, and it's a relief to think we can get rid of fat in a much gentler way now.
Here we offer a laser-assisted liposuction technique called Smartlipo. There are three main advantages to Smartlipo compared to old lipo. First, there's no general anesthesia, which is great because that's the biggest risk of any surgery. Instead, we numb you with a tumescent anesthesia, which is a type of local numbing medicine.
The second advantage is that the laser melts or liquefies your fat before we do the suction, so that makes the procedure much more gentle. I like to draw the parallel that it's like we're removing melted butter instead of grated cheese, although I know that sounds gross. Liquefying the fat not only makes the procedure easier on you, it also gives a much smoother result. Traditional liposuction can leave a lumpy or irregular appearance.
The third advantage is that the laser has a temperature guide on it, and we heat the skin to a certain temperature so that your skin tightens, and that's important. Although there's always a risk of some skin sagging after all types of liposuction, almost everyone gets skin tightening with Smartlipo. Obviously, like it is with all things, the younger you are, the more skin tightening you get. The whole procedure takes about 2 hours. The Smartlipo procedure is done in 3 steps. Well, first of all, you have to have a driver bring you to the procedure. The first step is to give you some painkillers and tranquilizers, and then we make 3 to 5 small punctures in your skin to put the numbing medicine in. The lidocaine is mixed up with IV fluid, so it makes you real puffy. The second step is the laser, which you generally don't feel at all when we're liquefying the fat and heating up your skin. And the third step is suction.
Immediately after the procedure, you're pretty groggy, and you may not remember it. You'll also be wearing a compression garment that's sort of like a shorty wetsuit, or leggings if you've done your thighs or knees, or an ace bandage wrap around your head if you've done your neck.
This is a surgical procedure, so you'll be sore. 9 out of 10 times our patients only take anti-inflammatories for the pain. Pain varies from patient to patient. In general, patients report pain more if they have more fat taken out. As far as returning to normal activities, by day 2, most people can go to the grocery store and do all their normal, light daily activities. Most people return to work in 2 to 3 days, as long as they aren't doing heavy physical labor. For the first week or 2, just for your own comfort, we recommend not doing any weightlifting or really intense exercise like CrossFit or running. At 2 weeks, 95% of people are back doing all normal exercise activities, but you're generally sore for weeks, sometimes a couple of months. And you probably don't want to hit the beach for 3 or 4 weeks.
Fortunately, complications from Smartlipo are generally low. As with all procedures, there's some risk of infection, but we do this in a sterile setting and put you on an antibiotic to minimize that risk. About half the patients bruise, and you're definitely sore for a few weeks. You'll have some skin numbness, which generally goes away after a few weeks to a few months. Of course, your packet of information will discuss all of this in much more detail.
Let's talk about results. It's not uncommon to wonder if this worked for a few weeks because you're so swollen from the procedure. Most of our before and after pictures you see are taken at about 2 or 3 months, but the best results are at 6 months. That's when all the skin tightening is complete. And by the way, many of our patients have 2 or 3 procedures done on different parts of the body.
And let's talk about the big lipo myth. Patients oftentimes wonder if liposuction causes fat to build up in other areas. Fat only builds up in other areas if you gain weight. I like to think of it as fat is lazy, so it picks the area of least resistance, which isn't going to be an area where you had liposuction, unless you gain a ton of weight.
Smartlipo is best for people who are close to their normal body weight, but can't lose certain areas of fat. Certainly we do Smartlipo on people who are overweight, but it's important we discuss your expectations. The most common areas we treat are abdomen, flanks and back, inner and outer thighs, and neck and lower face. Of course, we also do knees and arms and bra fat. There really isn't a fatty area we can't treat, except the buttocks. It's just too hard to make that even.
Smartlipo is not generally the best procedure with obese patients or patients with really loose skin, and we can't do it on smokers or anyone who uses nicotine in any form. There are some medications that interfere with the local anesthetic or increase your risk of clotting, so we'll look through your medications and may stop some of them a few weeks prior to the procedure.
Smartlipo is for sure the best, most effective way of getting rid of external fat. And it shrink wraps your skin over your new shape at the same time. In terms of results, there's nothing better.
But you really have to be into this and ready for some discomfort and some recovery time. For some of our patients, it was a bigger deal than they anticipated, and they were disappointed that they weren't totally fine and having complete results after a week or two. It takes longer, but the results are worth it, because this one really works.